Welcome to our video on substance use disorders, also commonly known as addiction. We know this is a challenging topic, and we're here to support you every step of the way. Our goal is to help you understand substance use disorders and share practical information so that you feel informed, confident, and ready to support others. If you'd like a deeper dive, check out the Introduction to SUD for Family video. At the end of the video, please complete the post-learning check-in found on the Family Learning Series webpage. This brief check-in will provide feedback to DDAP on the usefulness of this video and offers the opportunity for suggestions on future learning to possibly be developed. Individuals seeking treatment or support for themselves or a loved one can call the toll-free PA Get Help Now helpline at 1-800-662-4357. It's available 24 hours a day, 365 days a year, and staffed by trained professionals. A live chat option is also available online or via text message at 717-216-0905. For those seeking help who may not be comfortable speaking to a helpline operator, remember, you are not alone in this. This training will cover what substance use disorder is and how it works in the body. It will also cover different types of substances involved in SUD, the treatment process, and the recovery process. Now, let's begin. Substance use disorder, or SUD, means someone has trouble controlling their use of a substance, like alcohol or drugs, even when it causes problems in their life. Substance use disorders are very common. About 1 in 6 people in the U.S. meet the criteria. You might also hear the word addiction. It means the same thing as substance use disorders. Substance use disorders are long-term health conditions, similar to diabetes or heart disease. It can be managed with the right help. People have tried to explain substance use disorders in different ways. This has led to current-day stigma, shame, blame, and stereotypes around substance use. Today, based on science and data-driven information, we use the disease model. This means substance use disorders are a medical condition, affected by genetics and the environment. People with substance use disorders can get better with support and treatment. Here are some words you'll see in this video. Tolerance. When someone needs more of a substance to feel the same effects. Dependence. When a person's body gets used to a substance and needs it to feel normal. Withdrawal. Commonly known as detox, withdrawal is physical dependence. It includes uncomfortable symptoms that happen when someone stops or cuts back on a substance. Return to use, commonly known as relapse, is when someone returns to use when they had previously managed to reduce or stop completely. The circumstances and factors leading to substance use can vary greatly from person to person, and may involve a combination of factors such as experimentation, peer pressure, or other factors. Next, we will discuss the effects of SUD on different age groups and the impact of stigma. Adolescence is a critical development window. During adolescence, the prefrontal cortex is still developing. The prefrontal cortex is the front part of the brain that acts as a control center and is involved in decision-making, attention, and controlling emotions and impulses. Adolescents may experience peer pressure or may use substances to cope with anxiety, sadness, and trauma. Adolescence is marked by a period of developing an identity. During this time period, they are more likely to take risks or try things, without having the ability to consider long-term consequences. Substance use disorder in older adults is often missed. This is due to overlapping symptoms and medical conditions, or may be regarded as a normal part of aging. Some risk factors in older adults include chronic pain, multiple pain medications, social isolation, bereavement, changes in living situation, and mental health issues. Many unintentional overdoses involve prescription medications in older adults. Due to age-related changes, such as drug metabolism and the prescribed use of multiple medications. An example of this may be taking multiple prescribed prescription drugs with alcohol. Older adults may experience stronger effects from substances due to age-related changes. In the past, people thought substance use disorder was a moral failing, which led to judging and blaming those affected. This stigma can make people feel ashamed or afraid to ask for help. Families may feel guilty or alone. We want you to know substance use disorder is a health problem, not a character flaw. Now we will discuss how substance use disorders work in the brain. Substance use disorders are caused by real physical changes in the brain. Our brains have a reward system that helps us feel good. When we do things like eat, spend time with loved ones, or achieve something important. Substances like drugs and alcohol can hijack this reward system by causing the brain to release much more of the feel-good chemical dopamine than normal activities do. Over time, the brain gets used to these higher levels of dopamine. Things that used to bring pleasure, like hobbies or time with friends, may no longer feel enjoyable. This is called tolerance. The person needs more of the substance just to feel the same effects. The brain also learns to connect certain people, places, or things with the substance. Just seeing something related to the substance can trigger strong cravings, because the brain expects the same good feeling as before. Substance use disorders affect different parts of the brain. The prefrontal cortex is the area that helps us make decisions and control our impulses. When someone has substance use disorder, this part doesn't work as well, making it harder to say no to the substance, even if they want to stop. The limbic system is the brain's survival center. It helps us do things that keep us alive, like eating and sleeping, by rewarding us with dopamine. When someone uses substances, this same system is activated. But over time, the brain starts to treat the drug as if it's more important than food or shelter. Substance use disorders also affect the parts of the brain that handle stress and emotions, making it harder to manage feelings and cravings. The changes in the brain can make quitting very difficult, even when someone truly wants to stop. However, with support and treatment, the brain can heal, and many of these changes can be reversed. People develop substance use disorders for many reasons, including genetics, mental health, and life experiences, such as misuse of prescription medications, previous injury, self-medicating, and trauma. These factors represent one pathway to substance use and may not represent the experience of all. Social factors also play a big role. Growing up in poverty or facing financial hardship can increase stress and make it harder to access stable housing, education, and healthcare. These difficulties can make it harder for someone to get support and increase the risk, making the path to substance use disorder complex and unique for each person. Now we will discuss the methods of use and different types of substances. Substances can be swallowed, injected, or inhaled. Each method affects how quickly and strongly the drug works. Withdrawal, polysubstance use, and overdose risks vary by substance. Polysubstance use means using more than one drug at the same time or close together. This can happen by choice or by accident. An example would be when drugs are mixed without someone's knowledge. Mixing drugs increases the risk of overdose, severe health problems, and death. For example, xylazine, a veterinary tranquilizer, is sometimes mixed with opioids like heroin or fentanyl, often without the person knowing. Opioids include painkillers like morphine and codeine, as well as heroin and fentanyl. Opioid withdrawal can start within 6 to 24 hours after last use and may last several days. Symptoms include muscle aches, sweating, anxiety, and nausea. While opioid withdrawal is usually not life-threatening by itself, combining opioids with other depressants, like alcohol or benzodiazepines, can be very dangerous and increase overdose risk. Stimulants, such as cocaine, methamphetamine, and prescription amphetamines, speed up the body. Withdrawal may cause strong cravings, fatigue, depression, sleep problems, and even paranoia. The biggest risk is severe depression, which can sometimes lead to thoughts of suicide. Depressants are drugs that slow down the central nervous system and include alcohol and benzodiazepines like Xanax. People often use these substances to relieve stress, anxiety, or to help with sleep. Because they slow brain activity, they can cause relaxation, drowsiness, and sometimes confusion or memory problems. Withdrawing from alcohol or benzodiazepines can be very dangerous and should always be done with medical supervision. The severity of withdrawal symptoms depends on how much and how often someone has been using. Symptoms can include shaking or tremors, sweating, anxiety, nausea, trouble sleeping, hallucinations, seizures, and a serious condition called delirium tremens, which can cause confusion, severe agitation, and even death if untreated. Tremors, often called the shakes, are common and usually most noticeable in the hands. If someone is dependent on depressants, stopping suddenly can be life-threatening. Always seek medical help for withdrawal from these substances. Xylazine, also known as Tranq, is a veterinary tranquilizer that is not approved for human use. People who use xylazine may lose track of time, have gaps in memory, and find it hard to stay awake. It can cause memory loss, drowsiness, and wounds that may become infected. Seek medical care for wounds that get worse, smell bad, or are very painful. Medetomidine, also known as Rhinotranq, is another veterinary tranquilizer that is not approved for human use and is frequently being found in fentanyl. Medetomidine is stronger than xylazine and longer lasting. Medetomidine is known to cause sedation and a slowed heart rate. Cannabis includes marijuana and synthetic types like K2 or spice. Withdrawal symptoms can last up to 2 weeks and may include anxiety, trouble sleeping, headaches, and tremors. THC content is often much higher in current marijuana strains, and chronic use can potentially lead to more severe symptoms, such as psychosis or loss of contact with reality. Inhalants are found in household products, such as keyboard cleaning spray or canned whipped cream, and are inhaled for their effects. They are very dangerous and can cause seizures, coma, and death. Withdrawal may include mood swings, nausea, and sweating. Now that you know the different types of substances, we'll discuss how an overdose happens and co-occurring conditions. An overdose happens when too much of a substance overwhelms the body. Using more than one drug at the same time increases the risk of overdose. Naloxone is a medicine that can reverse opioid overdoses, but some drugs like xylazine may delay recovery even after naloxone is given. It is not necessary to give more naloxone if the person is breathing, as they may remain unconscious for a while due to other substances. Many people with substance use disorders also have a mental health condition. Approximately 21.5 million adults in the United States have a co-occurring disorder. When both conditions are not addressed together or addressed one at a time, the condition not being treated can become a trigger as it can exacerbate the other. This can be discouraging for families, watching their loved ones make progress in one area only to regress in another. Integrated treatment refers to treatment that focuses on mental health and substance use disorder treatment simultaneously. When treatment comprehensively addresses all diagnosis and symptoms, outcomes are better. Treating both conditions at the same time is important for recovery, as integrated programs recognize that both conditions are connected and must be addressed together. This leads to better outcomes, promoting recovery, improving symptoms, and better quality of life. Before we wrap up this video, we will discuss treatment and recovery. Recovery is a personal journey. There's no one-size-fits-all solution. Treatment should be tailored to each person's needs, and there are many pathways to recovery. Some key services are case management, helps coordinate care and connect individuals to needed services. Counseling includes individual, group, or family therapy to address emotional and behavioral needs. Medications can help manage withdrawal, reduce cravings, or treat co-occurring mental health conditions. And peer support services offers encouragement and understanding from people with lived experience. Local county drug and alcohol agencies can help with treatment funding, assessments, and referrals, especially for those who are uninsured or underinsured. The first step is to contact your local agency. They will guide you through the process and help connect you to the right services. Recovery is a process, not a single event. If someone returns to use, especially within 90 days, it means they need more support, not blame. The focus should be on support rather than prevention. Recovery isn't just for the individual. Families also need to heal. Family support, knowledge, and compassion can be powerful motivators for change. Families are an important part of recovery. The ways that families interact with each other can support or hinder recovery. Sometimes stress and misunderstandings can add to the challenges that a loved one faces. But families can be a source of strength and encouragement. When families get involved in treatment together, they often find that communication improves, conflicts are reduced, and their relationships grow closer. Working together as a family can help everyone feel more connected and supported. These resources provide valuable assistance, guidance, and community connections. 12-step programs such as Al-Anon family groups and Nar-Anon family groups provide support for families and friends of individuals struggling with drug and alcohol use. Meetings can be found on their official websites and may offer both local and virtual meeting options. Some other program options include Smart Recovery, which is an alternative to a 12-step program. Grasp Grief Recovery After Substance Passing, which provides support for those who have lost a loved one to drug and alcohol use. And Learn to Cope, which is a peer-led support group for families. Local county drug and alcohol agencies can help connect with treatment, funding, and other recovery supports. Each county drug and alcohol agency is different in terms of services offered. Please reach out to your local county drug and alcohol agency to determine what resources are available in your area. Substance use disorder, or SUD, is a common and complex medical condition that affects the brain and behavior, making it difficult for someone to control their use of substances despite harmful consequences. It is not a moral failing or a lack of willpower. Recovery from substance use disorders is a personal journey that looks different for everyone. And with the right treatment and support, people can and do get better. This video has shown that understanding substance use disorders means recognizing it as a chronic health condition, influenced by many factors, including genetics, environment, and mental health. Treatment involves a range of services tailored to individual needs, and recovery includes progress through different stages, with setbacks being a normal part of the process, not a failure. Families also play a vital role in recovery, and healing together strengthens the journey. If you'd like a deeper dive, check out the Introduction to SUD video. Thank you for taking this step to learn and support your loved one. Your involvement truly matters. Thank you for watching DDAP's Understanding Substance Use Disorders video. Please complete our quick post-learning check-ins so we know how beneficial this was for you and to offer any suggestions you may have for other videos you would like to see. Don't forget, you are not alone.